Hi, folks. Thanks for joining us today. I'm Lacey Ryan, founder of Creative Family Counseling, which is a group practice located in Louisville, Kentucky, in the Linden area of town. And I have with me my friend and colleague, Dawn Pendleton, who's a fellow licensed marriage and family therapist. And she's going to be telling us a little bit about a therapeutic modality that we offer at Creative Family Counseling called EMDR. So, Dawn, why don't you go ahead and introduce yourself?
Sure. Thanks, Lacey. As Lacey said, my name is Dawn Pendleton, and I'm a licensed marriage and family therapist, and am also certified in EMDR. And let me first start out by saying EMDR stands for eye movement, desensitization, and reprocessing therapy. But if I could, let me take just a minute and kind of tell you kind of about myself and my practice over the years. So I've been in practice for over 20 years. And in that course of time, I've used numerous different approaches, a lot of traditional talk therapy approaches, a lot of narrative and person-centered kind of work with folks before I became certified in EMDR, trained and certified in EMDR. And I'm a big believer in who we are and what our stories are really has a big part to do with how we approach the world and how we approach relationships with other people in it. And so my goal is to help people that I get to work with heal in as short an amount of time as possible, but also taking the time that's necessary for them to really come to a place where they genuinely thrive and love who they are and what they have to offer the world.
And so some of that is why you are so passionate about using EMDR then, is the difference that it has made for your clients.
Yes, absolutely. So I had been practicing for probably about 10 years before I even learned about EMDR. And when I learned about it, it immediately struck something in me and really made sense to me. So I went out and got trained in it right away. I found a training that was taking place, I want to say maybe 2 months later. And it was quite a rigorous training process, but well worth it. And as soon as I finished the initial part of the training, I went back to work quite literally the next day and started using it with clients. And what I noticed was really how powerful it was in really healing the whole self. And, you know, again, the approaches I had used for years prior were great. And I still continue to use a lot of those methods. But what I did find is that a lot of the traditional talk therapy models tended to take longer, and things would resurface after a period of time for folks. So what I found in EMDR is that it really worked on the beliefs a person had about themselves. So really, what's that negative self-talk, what those painful, deep-seated emotions were that the person was experiencing, usually connected to specific incidents or events and experiences in their lives, and also where that got physically stored within them. And so with talk therapy, I really couldn't help folks get at that where things were physically stored. And so what would happen is that stuff would start to resurface later. And what I noticed to be so powerful was that EMDR really addresses every aspect of self and tends to, in general, work more quickly. I will say that is a relative term, but tends to work more quickly than traditional talk therapy methods, and also really has more permanent and long-lasting results because it clears everything that's really connected to these negative experiences for people.
Wow. Okay. You referred to some training as well as certification. So I'm curious if you could speak to who can practice EMDR and what is the difference between trained and certified.
Sure. So when I was trained, and like I said, this has been over 10 years ago, so some things may have changed in that time, but at the time I was trained, a person had to go through at least what was considered basic EMDR training in order to utilize the EMDR approaches with clients. What that involved in my experience was there's basic training part 1 and part 2, and that really technically a person could utilize the approaches after part 1. But each part was a 3-day intensive weekend all day long that involved the first half of the day was really kind of classwork, doing all the theory and sort of book work. And then the second half of each day was about 4 to 4.5 hours of actually going through the work with other participants in the training. So we got to experience what it's like, which I always think is a much better training experience when we get to go through it on both the therapist and the client side. So in those 2 weekends, between part 1 and part 2, were 6 months apart. In the meantime, I was expected to obtain 5 hours of what the EMDR Institute calls consultation or supervision. And I needed to practice using it during that time. So I obtained an approved EMDR consultant here in town. I was lucky enough to, in Louisville, we're lucky enough to have a lot of folks actually who are approved consultants. And then after the second weekend of the training, so I was at that point considered basic trained. And in order to obtain certification, so actually I needed to do 5 more hours of the consultation to technically be basic trained. But then to become certified, I had to have a total of 20 hours of consultation and also obtain an additional 12 hours of continuing education specifically in EMDR. And so I've been certified for about 8 years, I think, if my timeline's correct. And then every year I'm expected to do a minimum of 14 hours of continuing education in specifically EMDR approaches.
Yeah, and I think that's so important to note because it's such a neurology-based therapeutic method that you do, as research grows and grows each year, you have to stay up on that training with those continuing education hours.
Exactly. Yeah, and there have been lots of different ways that the standard approach of EMDR has really been built on over the years, where people are, I won't quite say modifying, but I'll say accentuating the standard protocol to really target other specific treatment needs, such as specific to addictions or specific to chronic pain, specific to obsessive compulsive type behaviors. And so that's a really exciting thing. And again, there's a lot of training and a lot of research and a lot of workshops that are available for people to really delve into those areas. And also I'll say one of the big areas has been also specifically using EMDR with children, which we do creative family counseling as well, because it's really different to use this model with little humans than it is with adults. Yeah. So it's really been wonderful that people in the field are really taking hold of this and looking at how it can be used for really any sort of treatment need.
Well, that kind of brings me to my last question, which is who do you treat with EMDR, and what sorts of individuals should seek out EMDR therapy?
Yeah. So one of the things I'll say to speak to that is it was initially really put out there to be used with major trauma. And that was how it really was kind of born and developed back in the early days of EMDR, which is over 30 years ago. And so anyone who has experienced any kind of major traumatic episode is really a prime candidate for EMDR treatment. Ideally, the closer to the traumatic incident, the better, because everything's so fresh, and the healing can actually take a much shorter amount of time and energy, and it keeps the person from just being in pain longer. But also, people who experience anxiety, performance anxiety, social anxiety, people who have difficulties in relationships, particularly if it's connected to how they see themselves or what they believe about their worth or their deserving in relationships with others. I use it with a lot of clients who are in the LGBTQI community. Unfortunately, there are a lot of negative messages for individuals in that community, and that can really be internalized by a person who identifies somewhere on that continuum. And so I will often use that with folks in that community so they can really see themselves more accurately and authentically and really kindly and love themselves and accept themselves for exactly who they are. I also use it a lot with high achievers. So people who either athletes, executives, artists who somehow find themselves getting stuck and they're not quite sure why, because there doesn't seem to be any kind of external reason that's keeping them from reaching their next benchmark. So that's another group of folks with whom I use this particular approach.
Yeah, thank you. And
Absolutely.
you did mention earlier that a lot of clinicians, including some at Creative Family Counseling, provide EMDR services for children, which for children is usually much shorter in duration than even adults. And so EMDR shortens the therapeutic experience oftentimes in general for people, but it's even more so with children. It can be a very quick healing process for them, along with the other therapies that we offer. So thank you for speaking to that as well.
Absolutely. I mean, one of the things that I really find or have found in using EMDR with the clients that I have the privilege of working with, have had the privilege of working with over the years, is that once the EMDR process is finished for them, they're on a different path in life, that that they are quite literally on a road that was previously not accessible to them because of the trauma or negative or uncomfortable experiences that they had gone through, that got tangled up with these negative beliefs and views of themselves. And so it really is so powerful to see when a person has healed through this particular method, and it's like a complete change in direction, and not in a bad way at all, but certainly in this really healthy, positive, and exciting way that it opens up doors that were just not possible for them before.
Yeah, it's an incredible resource.
It is. And so, I would say that if there's anyone out there who happens to be watching this right now and this has struck a chord inside them and they feel like this might be a beneficial approach for them, I would encourage them to find, look in your area, find someone who is certainly at least trained in, if not certified, in the EMDR approach. And there are really easy ways to find that through the EMDR, EMDR.com or EMDRIA.org, which is the EMDR International Association website. So.
Okay. Well, thank you so much for spending some time with us today to share a little bit more about such a powerful tool that you use, as well as other clinicians. And thank you.
Absolutely. Well, thanks for the invitation to have this conversation, Lacey. I sure appreciate it.
Yeah. All right.
Okay.
Thanks, guys. Thanks for tuning in.